Mr. Grinch and Cindy Lou.
Hi there!
Thanks for coming on the show.
Thanks for coming on the show. Grinch!
So do you mind sharing how you became interested in the topic of heart failure?
Well, my friend Mr. Grinch recently had a change of heart. But it turns out having a heart grow 3 sizes is not exactly healthy. You have heart failure, Mr. Grinch. Your heart is way too big.
Let's start by going over some anatomy of the heart.
Great.
The heart is essentially a big pump to get blood to the whole body, but I want you to think of the heart in 2 different sides. Let's start with the left. The star is the left ventricle.
No, it's not. It's on the right side.
Well, we're looking at someone, so it's on their left side.
What? Ignore him. Please continue.
The left ventricle pushes blood through the arteries to the organs and returns blood through veins back to the heart.
I'm with you so far.
The veins return to the right side of the heart. The right ventricle pumps blood to the lungs.
No.
The lungs breathe out carbon dioxide, bring in oxygen, and we have oxygenated blood that's ready to get pumped by the left ventricle.
The right side goes right to the lungs, and once it's left the lungs, it goes to the left side and pumped out the ventricle.
Perfect.
Great. So what is heart failure?
So going back to the left ventricle, it normally pumps about 60 to 70% of what's in there. We call that an ejection fraction.
Okay.
If it's pumping less, then that causes problems. The name of that diagnosis is heart failure with reduced ejection fraction, sometimes referred to as congestive heart failure.
What kind of problems does that cause?
If the heart can't pump as well, more fluid backs up. Over time, the heart can become loose and floppy.
Where does fluid back up?
Remember, right before it goes to the left ventricle, it goes to the lungs. So you can have fluid collect around the lungs called pleural effusions.
Just the lungs?
If the lungs are backed up, then the veins can get enlarged and you can get fluid in your legs and liver.
Oh dear.
Some symptoms consistent with heart failure: inability to lie down flat or orthopnea, swelling of the legs called edema.
Is that how you tell it's heart failure? They have puffy legs?
No, swelling of the lower legs is fairly common and can happen just from having looser veins. We usually just recommend compression stockings and keeping your feet up in those cases.
How do you know they have heart failure?
The best way is to get an echo.
Easy. I have one of those.
Oh, good.
Yes, here at my house.
What?
Hello! Hello! I'm an idiot! You're an idiot!
Guess we can go now.
Sorry. I mean, you get an echocardiogram. It's an ultrasound of the heart.
Why? What does that tell you?
1, it tells you the ejection fraction, but it also tells you if there's valve problems, fluid collections around the heart, and other issues.
What causes this? Being nice for once?
No, but that's a good question.
That's a good question. Be nice. He just said it's not important.
There's a lot of causes, but I'll share 3 of the most common reasons. 1 is heart attacks and coronary artery disease.
Remind me what that is again.
The arteries of the heart, if they're narrowed or blocked, those muscles of the heart can get weak and parts of it don't work as well. Many times after we find the diagnosis of heart failure on an echocardiogram, a cardiologist will often do a cardiac catheterization and look at the coronary arteries to make sure they're okay.
What's number 2?
Substance use. History of meth, cocaine, and strong alcohol are very common reasons to have heart failure.
Nope. Definitely doesn't apply. What's number 3?
Abnormal heart rhythms. If someone has a long-standing arrhythmia such as atrial fibrillation, where their heart isn't contracting properly, that also can lead to reshaping of the heart.
Reshaping?
When the heart changes sizes and shape, that's called cardiomyopathy.
So once you've done an echo and you're sure someone has heart failure, what do?
You may have heard of water pills.
Water pills? No, my pills are solid, weirdo.
No, I mean a diuretic pill.
What? A pill that gives you diarrhea? What kind of sick doctor are you? Settle down, please. Doc, can you explain?
Sorry, let me back up a bit. Remember how I said if the heart isn't working, fluid backs up?
Yeah, in the lungs, the legs, and stuff.
Right. Diuretics act on the kidneys to help you pee off excess fluid so you can breathe easier and move better.
Ah, okay. Should have started with that. So you just give water pills?
No, some of the things we do help with symptoms, but these don't help you live longer.
What does help?
Guideline-directed medical therapy. This is a combination of different medications. These medications help reshape your heart to help them pump more effectively.
So will his heart go back to normal size and have a normal ejection fraction?
Well, it depends on what's causing your heart failure. Sometimes by stopping the substance abuse or correcting the arrhythmia, you can see massive improvements in your ejection fraction.
We'll see if things change. Things never change around here.
What do you mean?
You wouldn't understand.
Listen, I know this is a lot of information to take in, and it's very understandable to feel frustrated and overwhelmed.
I don't think this is just about heart failure.
It's not?
They just wrote an article in the paper, and it kind of bumped him out.
Oh.
Who, people? Please, if you will enjoy this video, remember to like and subscribe.